Martha, do you want to have a feel of that?
So soft.
It's totally soft. So the lung is the most fragile of the organs, and therefore was really the last of the major organs to be able to be transplanted. And this lung is alive. So while it's sitting here, it's not dying anymore. We're facilitating recovery. What are you doing?
Photographing. It's interesting.
It is. You got a good shot of it.
It is. It's amazing.
It is amazing.
I will tweet this because
yes.
no, it's fascinating.
Yes, we're on Twitter, so
Are our lungs that color? I thought our lungs were redder.
yeah. So our lungs are slightly pinker, and if you smoke or you live in a polluted city, then there'll be little black soot spots on it. But this is sort of what a healthy young person's lung would look like. Part of the achievement here, and really the big breakthrough, was the fact that we can keep a lung at normal body temperature for a day now. Now this looks like science fiction to you, but it's not. We're doing this today. We have transplanted 30 patients using this technique, using lungs that we wouldn't have used, and now 30 people are alive because they got their lung transplant in the last year in Toronto.
For a man diagnosed with Alzheimer's disease 6 years ago, Robert Linton is doing exceedingly well. He still drives.
46 across.
He can still pull off a crossword puzzle. Where many with the brain disease might have been in a nursing home, Robert credits his normalcy to an experimental device implanted into his brain.
I think it's the answer to Alzheimer's. 100%.
Robert was one of 6 Canadian Alzheimer's patients given deep brain stimulation.
Yeah, I'm okay.
Doctors at Toronto Western Hospital implanted 2 electrodes. They send electrical bursts 130 per second into the region that governs memory,
Just bright lights.
an area usually damaged by Alzheimer's.
Nice and warm. Very nice, so very pleasant.
The system is powered by a battery pack that sits in Robert's chest. While this unusual treatment had no effect on 3 patients tested, 2 stabilized, and Robert showed improvements to the delight of doctors. This is Ellen Campbell on the road to recovery, aggressively embarking on physiotherapy just slightly over 2 weeks after receiving her new lungs. Even her doctors are impressed.
Because she's so motivated is really a remarkable example of what can be achieved.
The 21-year-old had a fatal lung disease, and with time running out, doctors finally found suitable lungs, but from a much larger donor, and so cut them down to fit her smaller chest.
We transplanted the left upper lobe and we transplanted the right lower and middle lobe. So from a technical surgical point of view, that adds a bit of complexity.
But the lungs are working well. Hélène is breathing on her own, and her family is grateful to the donors.
My daughter has life because of that gift.
She's a girl who may have helped engineer her own rescue, harnessing social media, urging people to become organ donors, enlisting Justin Bieber and Ellen DeGeneres in her campaign.
I want to tell everyone watching today how they can make a difference.
Instead of the usual 15 organ donor pledges a week in Ontario, officials say 4,000 to 5,000 have signed up in the following weeks.
5 times a day for the last 5 years, Fatima Martin would check her husband's blood pressure.
I'm always scared that something is going to happen to him.
Medications, diet and exercise, nothing would lower his blood pressure.
Started with 1 pill and then 2 pills, and now I'm up to 6 pills a day and on blood pressure pills.
It's still
not controllable.
But this afternoon, for the first time in 5 years, Louis Martin's blood pressure is normal.
So everything went beautifully today.
He's the first in Canada to have his blood pressure lowered with no medication, no lifestyle change. Instead, doctors lowered it through a vein in his leg. Using a radio frequency probe, they severed the nerves near his kidneys, known for regulating cholesterol.
And it's been shown experimentally that if you interrupt those nerves, you lower blood pressure. You make a spiral going down the artery, so the idea is you're really trying to destroy those nerves permanently. Will that be the case? Time will tell.
Just hours after the procedure, Louis' blood pressure is reading normal.
You are witnessing something of a miracle. 4 years ago, Glenn Williams fell on ice, broke his neck, and was paralyzed, fearing he would never walk again.
It was the scariest day of my life. I knew I was in for a lot of trouble.
But he became part of a North American study asking the question, if patients like this get surgery quickly to ease pressure on their injured spinal cords in their neck, does that reduce their risk of disability? Half of the patients waited the usual 2 days for their conditions to stabilize before undergoing this decompression surgery. Glenn was among those treated quickly, just hours after the accident.
This is a bone screw that's in the C2 vertebra.
Researchers found those who had the surgery within 24 hours of their accident were almost 3 times more likely to regain many body functions, from bladder control to walking.
If we look at 10 individuals who are treated, 2 of those individuals potentially are walking away from an injury that they might not normally walk away from.
So where years ago Glenn might have lived in a wheelchair, he can now fetch his own firewood.
The second day I was able to move my ankle. The next day I think I was able to wiggle a thumb. I would say I have 90% of my life back.
Some say it's proof we need to start treating spinal cord injuries like we do strokes, quickly and at specialized centers, to prevent permanent disabilities from setting in.